basically what this says, this is a whole lot of protocols of separating people, and we don't know if this will or will not work. We have no clue. Now, this is based on keeping a system clean. All right. This is based on clean systems / sterile systems. All right. Modes of entry. All right. Different things like that. Now, my question is, how do you guys feel about this? How do you feel about having to be in certain rooms? How do you feel about, having to be in a green area and not even in a healthcare setting? This is just, everyday. Yo, what up? Welcome to Corona Blacklight. It's your boy Rob, all right, coming at you with the very first video on Corona Blacklight. So everybody knows that the reason why I set up this channel is to specifically do C19 content, all right? So we don't damage the other channels. So this entire channel will be dedicated to C19 and everything about that. And we'll be putting this stuff up as long as the channel lasts. If the channel disappears, you're gonna have to go to BitChute for the content because it'll be over there. All right. So all you gotta do is look up Blacklight Revelations on BitChute. As soon as the channel is gone, we'll start throwing the content up over there. All right. So let's get into this. I actually have some pretty interesting stuff for you. All right. This is some crazy stuff. And anybody who wants to send content, feel free. The contact information will be on the About page. All right. So this is an article from NBC News, and this is a fairly recent article. All right. And it says, even for vaccinated people, now is the time for masks and testing, public health experts say. Even for vaccinated people. You got to ask yourself, huh? With the Delta variant ripping through the country, health experts suggest that most Americans get back to early pandemic basics. So they gave us a little bit of a teaser. They said, all right, y'all can have a little taste of freedom. Now we're going to take it back away from you. Now, my question for y'all, and I need y'all to write this into the comments because I can't say it. Why do you think they would do that? All right. As the highly transmissible Delta variant sweeps across every state in the country as the dominant strain of COVID-19, public health experts warn now is not the time to ditch masks or forego testing. If anything, the United States, particularly in areas where vaccination rates have stalled and coronavirus cases are rising, it is at an urgent juncture in the pandemic in which continued mask wearing and testing are pivotal because of how quickly the variant has been spreading, the experts say. I think it's critical to be masking indoors no matter where you live, Susan Hessig, an epidemiologist at the Tulane University School of Public Health and Tropical Medicine, said Wednesday as her home of Louisiana was poised to exceed the peak of hospitalized COVID patients since the pandemic began. All right. Every parish in the state is at the highest risk level, red, and Governor John Bel Edwards, a Democrat, on Wednesday announced an indoor mask mandate through at least September 1st for anyone 5 and older who enter places like schools, businesses, and churches, no matter their vaccination status. I can't tell you how different it feels than ever before, Hasek said. This virus is moving so fast, more and more counties on the local level are turning orange and red every day. It's critical to mask and test on suspicion of exposure. All right. Other parts of the South, including Florida, Mississippi, Arkansas, and Tennessee, are also struggling with COVID-19 surges as their vaccination rates remain below 50% of their populations. All right. The Centers for Disease Control and Prevention is recommending that masks be worn indoors in places with substantial or high COVID transmission or test positivity rates, which is currently about 80% of all U.S. counties. Carl Minges, the interim dean of the School of Health Sciences at the University of New Haven, said it's time for the majority of Americans to get back to early pandemic basics. All right, so this is what they're telling us. Starting now, all right, starting today, we need to start getting back to early pandemic basics. Now I have a question. I got two questions for you. For one, why do you think that all these Democrats want you to wear masks? And for two, why do you think all these conservatives just, they don't really have any kind of thing other than just continue life as it has been? Why are there the extremes? This is the question that I'd like people to answer for me. All right. What's going on with that? Right. Both sides of the government are literally supposed to be there to advise us to do the appropriate things. Right. No matter the vaccination status. Now, pay attention to this. No matter their vaccination status, and this is coming from NBC News, ladies and gentlemen. This isn't me making this up. Wear a mask, especially indoors. Socially distance and hand sanitize. Should we wash our hands, take showers, and shampoo too? Just asking. He said, try to continue most activities outdoors, whether eating or attending a concert, and beware of how crowded it may be and what the COVID-19 positivity rate for the area is. Yeah, because, when you just walk up in somewhere, you just go right to customer service and say, do you have the current rates of COVID-19 positivity? I mean, is that going to be posted on the door along with the maximum occupancy or what? How are we going to do that? Before I go shopping, I need to know what the COVID positivity rate is in this grocery store before I walk up in there and give you all my business. How's that going to work? The goal is to not return to the precautions of 2020. And that is unlikely the more people who become vaccinated, Minges added. On Tuesday, New York City became the first major city in the country to require proof of vaccination for indoor activities at restaurants, gyms, and performance spaces, with full enforcement coming in September. While about 55% of the city's population is fully vaccinated, the rate of new vaccinations has leveled off in recent months, and about 72% of tested cases of the coronavirus have been attributed to the Delta variant, city health data show. While many Broadway shows are still eyeing returns in September, major events are being scrapped because of the Delta variant's rise. The 2021 New York International Auto Show at the Jacob K. Javits Convention Center in Midtown Manhattan, which can draw about 1 million people, was canceled on Wednesday, just 2 weeks before it was scheduled to start. Elsewhere, it's business as usual. Concerts are selling out at near record levels, unless you're the baby. And major festivals and events are happening, like Lollapalooza, unless you're the baby, which was in Chicago over the weekend and attracted hundreds of thousands of fans, and the Sturgis Motorcycle Rally, expected to lure hundreds of thousands to South Dakota starting on Friday. Attending an outdoor concert in small social bubbles, if you are vaccinated and unmasked, is okay and should be up to a person's comfort level, said Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at the University of Chicago Medical Center. But that social setting is not the same as attending a large-scale event like a music festival where people are smushed together. The problem, Landon said, is the Delta variant is more contagious than the earlier forms of COVID-19. And at outings where large groups of people are interacting within a 6-foot radius, the window of time needed to transmit the virus is smaller. Before, you had to spend 15 minutes inside your 6-foot radius. Now, you only need to spend a couple minutes in there for exposure, she said. However, sporting events like a baseball game are different, she said, because people are typically socially distanced, may be wearing masks, and often face outward. Even if they're waiting in line, they're not bunched up in crowds like at a music festival. Experts say masks are especially important if you're going to be around people whose vaccination statuses are unclear and you can't keep your distance. You probably could have gotten away with not getting masked in a workplace if everyone was vaccinated pre-Delta, Hasek said. But Delta is different. Hasek also suggests that people consider enforcing masks again for weddings and parties, even if they're outdoors. There is no vaccination requirement and people are socializing in close proximity. All right. You may have medically vulnerable people coming, and it's only reasonable to think about what you need to do so that Granny doesn't catch coronavirus, she said. COVID-19 testing also should be used if someone is feeling sick or may have been exposed, experts say. Some employers, like big tech companies and government agencies, will require COVID-19 vaccinations for employees if they want to return to the office after months of working from home. And in some cases, those who refuse will be subject to regular testing. Landon said fully vaccinated people don't need to get tested regularly, but should if they have symptoms of COVID-19 or were exposed to someone who tested positive. The CDC suggests fully vaccinated people get tested 3 to 5 days after exposure, even if the vaccinated person has no symptoms, because they could be asymptomatic. So-called breakthrough cases of COVID-19 in which vaccinated people can get infected remains extremely rare, health officials say, and is not a failure of vaccines. What do you call it then? And again, I'm not doing anything. YouTube, don't do nothing to me yet. I'm literally just asking a question. How is it not a failure of the vaccine? What is it? The CDC recently updated mask guidelines were devised to ensure the vaccinated public would not unknowingly transmit to others, including their unvaccinated or immunocompromised loved ones. CDC Dr. Rochelle Walensky said last week. Hasek also suggested testing if you're going to be amid a large gathering where you don't know vaccination statuses, similar to what people were doing last summer when COVID-19 vaccines were unavailable. Ultimately, because standard COVID-19 tests cannot specify whether someone has the Delta variant, experts say it is safe to assume that if you test positive, you have the strain. That genie is out of the bottle, Hasek said, and unfortunately, it's a really nasty one, all right? So we got to make sure that we keep track on this Delta variant, all right? And the thing is that we all know, if you watch my content on Blacklight Revelations 1 and 2, then you know that this thing has been ever-changing, all right, ever since it first came into fruition, all right? Now, I found something interesting. Actually, I didn't find this. My girlfriend sent me a screenshot of this, and I researched it. All right, I didn't find it. I don't want to take credit for it. My girlfriend showed it to me. She's the one who gets full credit for this. She sent me this interesting post that was on the CDC website. All right, and what I want y'all to do is I want y'all to listen to me read every word that I'm going to say. And I want to know what y'all think about this. I want to know if you've heard about this. I want to know if you have any more information about this. I'd like you to send me links, all right, so I can do some further content, because this is kind of interesting and it's kind of scary. All right, so y'all ready for it? Let's check it out. This is it right here. The shielding approach. You guys ever heard of the shielding approach? This is kind of crazy, okay? Let's look at it. Interim operational considerations for implementing the shielding approach to prevent COVID-19 infections in humanitarian settings. My first question for everybody is, what in the hell is a humanitarian setting? This document presents considerations from the perspective of the U.S. Centers for Disease Control and Prevention, CDC, for implementing the shielding approach in humanitarian settings as outlined in guidance documents focused on camps, displaced populations, and low-resource settings. This approach has never been documented and has raised questions and concerns among humanitarian partners who support responsive activities in these settings. The purpose of this document is to highlight potential implementation challenges of the shielding approach from the CDC's perspective and guide thinking around implementation in the absence of empirical data. So isn't that interesting? So we're trying to figure out a way to guide thinking around implementing things with the absence of empirical data. Now I have a question for y'all. What does that mean? I need y'all to type that in the comments, because you know I ain't allowed to say it. Considerations are based on current evidence known about transmission and severity of coronavirus disease 19, which is COVID-19, and may need to be revised as more information becomes available. Please check the CDC website periodically for updates. What is the shielding approach? What is the shielding approach? All right, this is interesting. The shielding approach aims to reduce the number of severe COVID-19 cases by limiting contact between individuals at higher risk of developing severe disease and the general population. High-risk individuals would be temporarily located to safe zones or green zones established at the household, neighborhood, camp/sector, or community level dispensing on the context and setting. They would have minimal contact with family members and other low risk residents. So basically what we have here is a separation of people. We have people who have a high risk being separated from low risk people, all right? What do you guys think about that? What does that sound like? You remember those videos that came out around, 2005, about 2005, 2010 with certain things, black things, you know what I'm saying, in big fields. Remember that? Remember those videos? If you do, and you know exactly what I'm talking about, and you remember that government agency that stuff was associated, let me know. Current evidence indicates that older adults and people of any age who have serious underlying medical conditions are at higher risk for severe illness from COVID-19. In most humanitarian settings, older population groups make up a small percentage of the total population. For this reason, the shielding approach suggests physically separating high-risk individuals from the general population to prioritize the use of limited available resources and avoid implementing long-term contaminant measures among the general population. In theory, shielding may serve its objective to protect high-risk populations from disease and death. However, implementation of the approach necessitates strict adherence to protocol. Inadvertent introduction of the virus into a green zone may result in rapid transmission among the most vulnerable populations the approach is trying to protect. Now check this out. A summary of the shielding approach described by Favas is shown in Table 1. All right, so this is Table 1 right here, all right? Household level, a specific room or designated area for high-risk individuals who are physically isolated from other HH, which is household members. So basically that means that everybody else can be upstairs, you got to be downstairs. Low-risk HH, which is household members, should not enter the green zone. If entry is necessary, it should be done only by healthy individuals after washing hands and using face coverings. Now, this is indoors. Interactions should be at a safe distance, about 2 meters. I think 2 meters is about 6 feet. Minimum movement of high-risk individuals outside of the green zone. Low-risk household members continue to follow social distancing and hygiene practices outside the house. Neighborhood level, a designated shelter/group of shelters within a small camp or area where high-risk members are grouped together. Neighbors swap households to accommodate high-risk individuals. So we're gonna have to swap household. We're gonna have to get a whole bunch of healthy people in one house, and we're gonna have to get a whole bunch of unhealthy people in the other house. How's that work? Camp/sector level. A group of shelters such as schools, community buildings within a camp/sector, maximum 50 high-risk individuals per single green zone, where high-risk individuals are physically isolated together. One entry point is used for exchange of food, supplies, and etc. A meeting area is used for residents and visitors to interact while practicing physical distancing. No movement into or outside of the green zone. All right. This is off the chain. Operational considerations. The shielding approach requires several prerequisites for effective implementation. Several are addressed, including access to healthcare and provision of food. However, there are several prerequisites which require additional considerations. Table 2 presents the prerequisites or suggestions as stated in the shielding guidance document, which is column 1. And the CDC presents additional questions and considerations alongside these prerequisites. All right. Suggested prerequisites. Each green zone has a dedicated latrine bathing facility for high-risk individuals. Considerations as suggested by the CDC. The shielding approach advises against any new facility constructions to establish green zones. However, few settings will have existing shelters, communal facilities with designated latrines, bathrooms, facilities to accommodate high-risk individuals. In these settings, most latrines used by HH are located outside the home and often shared by multiple HH. If dedicated facilities are available, ensure safety measures such as proper lighting, hand washing, hygiene, infrastructure, maintenance, and disinfection of latrines. Ensure facilities can accommodate high-risk individuals with disabilities, children, and separate genders at the neighborhood/camp level. All right. To minimize external contact, each green zone should include able-bodied high-risk individuals capable of caring for residents who have disabilities or are less mobile. Otherwise, designate low-risk individuals for these tasks, preferably who have recovered from confirmed C-19 and are assumed to be immune. This may be difficult to sustain, especially if the caregivers are also high risk, as caregivers may often will be family members. Ensure that this strategy is socially or culturally acceptable. Currently, we do not know if prior infections confirm immunity. So then you got to ask, well, why'd they put that there? The green zone and living areas for high-risk residents should be aligned with minimum humanitarian standards, and this is something called SPHERE. The shielding approach requires strict adherence to infection prevention and control measures. They require uninterrupted availability of soap, water, hygiene, and cleaning supplies, masks, cloth face coverings for all individuals in the green zones. Thus, it is necessary to ensure minimum public health standards, all right, are maintained and possibly supplemented to decrease the risk of other outbreaks outside of COVID-19. Attaining and maintaining minimum SPHERE standards is difficult in these settings for the general population. Users should consider that provisions of services and supplies to high-risk individuals could be at the expense of low-risk residents, putting them at increased risk for other outbreaks. Monitor and evaluate the implementation of the shielding approach. Monitoring protocols will need to be developed for each type of green zone. So we got these zones, man. My question is, what do y'all think about this? Dedicated staff need to be identified to monitor each green zone. Monitoring includes both adherence to protocols and potential adverse effects or outcomes due to isolation and stigma. It may be necessary to align someone within the green zone if feasible to minimize movement in and out of green zones. Men and women and individuals with tuberculosis, severe immunodeficiencies, or dementia should be isolated separately. Multiple green zones would be needed to achieve this level of separation, for each requiring additional inputs and resources. Further considerations include challenges of accommodating different ethnicities, sociocultural groups, or religions within one setting. I mean, this is a lot of stuff. This is a lot of stuff. So basically what this comes down to is that they want to separate people. The shielding approach is an ambiguous undertaking, which may prove effective in preventing COVID-19 infection among high-risk populations if well managed. While the premise is based on mitigation strategies used in the UK, there's no empirical evidence whether this approach will increase, decrease, or have no effect on morbidity and mortality during the COVID-19 epidemic in various humanitarian settings. So basically, what this says, this is a whole lot of protocols of separating people, and we don't know if this will or will not work. We have no clue. Now, this is based on keeping a system clean. All right. This is based on clean systems / sterile systems. All right. Modes of entry. All right. Different things like that. Now, my question is, how do you guys feel about this? How do you feel about having to be in certain rooms? How do you feel about, having to be in a green area and not even in a healthcare setting? This is just, every day. Delta variant. That's a lot, right? Thank goodness the video's over. So before I go, what I want to ask you guys is if you have coronavirus content respective to your state, any kind of content that you find, any article that you find interesting, hit your boy up. IG, email, Facebook, Blacklight Revelations. All right. And I will catch you on the next video. All right. Peace.